The subject today is the gummy smile. First of all, we must know few tips about normal smile. Also, we should know that the gummy smile not a disease. It's an embarrassing condition to some people. So, we start with normal smile, essential of smile. The teeth, lip framework, the gingival scaffold, all of it is the normal, essential, participate the normal smile. Component of the balanced smile, lip line, smile arc, and upper lip curvature, lateral negative space, also smile symmetry, gingival component between teeth, or what we call zenith of the teeth. The definition of gummy smile: gingival exposure on dental attractiveness, and found that the attractiveness of a person's smile is influenced by the amount of maxillary gingival exposure, which should not exceed 0 to 2 mm, not exceed 2 mm of gingival appearance. Examination also important, the symmetry of the facial and the proportion of lines which divide the head or the face to 3 parts, which is very important. The upper lip length, which is the distance between the base of the nose and lower border of the lip, which is in young adult female 20 to 22, while young adult male 22 to 24. Of maxillary sinus also different between male and female. Smile line, average smile line, 100% of clinical crown. Height of the maxillary incisor is display. Low, less than 75%. High, 2 mm of the maxillary gingival. Gingival scaffold also important. Health, harmony, continuity, symmetry of central incisor, balance to the lateral and cusped and premolars. Proportion: the teeth should fit the rule of golden proportion, which is, if we considered the central incisor 10%, the lateral incisor about 80%, then the central mesial of a canine appear more than distal of the canine. The width of central incisor about 75 or 80 from length of the central incisor. All this, it's very important to make the zenith or the nice appearance of the teeth. Gummy smile, excessive exposure of maxillary gingival during smiling. Etiology of this gummy smile: alter passive eruption, dento-alveolar extrusion, vertical maxillary excess, short or hyperlip, and combination of these. If the cause alter passive eruption or short or hyper lip activity, it is treated of soft tissue, while if there is a prominent vertical maxillary, treatment orthodontic or surgical. What we conduct or we treated active eruption of the teeth or passive eruption of the teeth. The active eruption, the occlusal movement of the teeth as it emerged from its crest in the gingival, this phase ends when the tooth makes contact with the opposing tooth in the oral cavity. Abnormal condition when the margin recedes apically to the level of cemento-enamel junction after the tooth has erupted completely. Classification: there is 4 types of a classification, depend on amount of the keratinous gingiva, amount of alveolar bone height, amount of biological width. Each